Another group of people are now eligible to receive the Pfizer vaccine. An infectious disease professor at UAB talks about the efficacy and importance of getting this group vaccinated. Our Nixon Norman has more.
Just yesterday, Pfizer announced that people aged 12 to 15 can now be vaccinated. A lot of research had to take place to get here, but the findings from these trials look promising.
This vaccine was 100% effective in terms of preventing coronavirus in 12 to 15-year-olds.
Being vaccinated will not only help protect this group from the coronavirus, but eventually provide them with a sense of normalcy again.
After being fully vaccinated, will not need to quarantine, which is really important for keeping these adolescents in school, keeping them in their summer enrichment activities, and really allowing them to have continued social interactions, which are so important for their development.
Eaton further assures that vaccines are safe for this age group and expects that vaccination will be encouraged by pediatricians.
We know the American Academy of Pediatrics, which is our national expert committee on pediatric health and wellness, has already endorsed this vaccine for adolescents ages 12 to 15. I take that as the ultimate vote of confidence from our pediatric experts, and I expect that a majority of our pediatricians are going to make this a priority going forward to encourage those adolescents to get vaccinated when they come in for their summer physicals, when they come in for other non-coronavirus related aches and pains, to get this group on board, educated, aware, and vaccinated.
She also talks about the vaccine from a parent's point of view.
Even if there have only been hundreds of American children who have died of coronavirus, I as a parent would want to prevent that low likelihood of an outcome in my child when there is a preventable tool, a tool to aid in prevention that is as safe and as effective as the vaccine.
Putting the Valley first, Nixon Norman, WZDX News.